Liraglutide, Saxenda, and Victoza are famous examples of diabetes medications. In today's Octopus Pharmacist product episode, we will discuss everything about them. We will take these medications and will be fully informed about them, as we are accustomed to. Are you curious about the sugar and slimming doses of these medications? What is the proper way to administer these medications? If someone used these medications and he would stop it and want to return to use again, will he return in the same dose? What are the most important tests we perform before administering these medications? Is it beneficial to use these drugs for weight loss without diet and exercise? This is a crucial episode in which we will answer 14 important questions about Saxenda. Stay with me. My name is Hussein Lotfi, and you are watching the Octopus Pharmacist channel. And there's a new episode of Octopus Pharmacist products. At the outset, these are the titles of today's episode. If you're looking for a specific title, accelerate the video until the title begins. If you need to know everything about Victoza or Saxenda, stay with me from the beginning to the end. Let's start by telling the story and determining how much important information about a subject we already know is liraglutide. Before that, we discussed all of the diabetes treatments. Among these treatments was a class known as glucagon-like peptide 1. And we used to use these medications as part of the treatment for type 2 diabetes. First, what is the primary function of this group in the body? Remember the term glucagon. This does not imply that it is glucagon hormone deficient. No, it simply means that their compositions are similar. First, when food is present in the stomach, this substance is secreted from the intestine wall and begins to move from the stomach to the intestine. Thus, the intestine corrects and exits the wall with its own beautiful hormone. This hormone continues to reach many parts of the body and provides numerous benefits. Because of this, food is absorbed and enters the blood, it begins to raise blood sugar, so the pancreas must take care of it and prepare insulin, which lowers blood sugar. The second point to mention is that this hormone also travels to the pancreas, but this time it inhibits the secretion of the glucagon hormone. Because glucagon raises blood sugar, this means it will also have an effect on lowering it. The third and most important information and the truth are that it is both an advantage and a disadvantage, is GLP-1 cause delaying gastric emptying. It means that it reduces stomach movement. When I reduce stomach movement, I am reducing or delaying the transfer of food from the stomach to the intestines. So, what are its advantages and disadvantages? The main advantage is that by reducing food transfer from the stomach to the intestines, this means that sugar will gradually enter the bloodstream, one by one. We have a chance for this exhausted pancreas to produce a reasonable amount of insulin every now and then, and thus it begins to store sugar in the tissues in a good and precise manner. The disadvantage is that delaying stomach movement by increasing the amount of food in the stomach causes nausea and very strong regurgitation, which is the main point that exists as a problem with the entire group, GLP-1. The entire GLP-1 group has many benefits for the liver, heart, muscles, and so on, but the most important advantage we take with this group is that these medicines reach the brain and significantly reduce appetite, and from this came the idea of using these medicines with patients who gain weight, whether they are diabetics or not. If you're gaining weight, and you're a type 2 diabetic, these medications will help you 3 times over. You will lose weight first, then improve your blood sugar level, and finally, you will save your heart. Keep in mind that not all medications belonging to the GLP-1 group are permitted to use for weight loss. A new substance is created every few months, but it is primarily used as a diabetes treatment. So far, we have been granted permission to use 2 substances in slimming. Liraglutide is a substance that is what we are discussing today, Victoza and Saxenda. We also have semaglutide as an Ozempic material. The second address is with us today, and the truth is that this is a very important address, and before we use these types of treatments, we need to know who is completely prohibited from using this group. The most dangerous case is that the person with thyroid tumors, whether he had thyroid tumors previously or a first-degree relative had thyroid tumors previously. So why? because this entire group has been linked to an increased risk of thyroid cancer. Assuming the person was healthy when he began receiving this treatment from a doctor, when did he suspect there was a problem? If he has symptoms of an enlarged thyroid gland, such as an enlargement at the base of the neck that is visible especially when shaving or applying makeup, a feeling of throat tightness, cough, hoarseness, trouble swallowing, trouble breathing. If any of these symptoms appear, we stop the treatment and go to the doctor right away. The second person not permissible for use is a person who has previously used any medicine from this class and is allergic to it. If he becomes allergic to one of them, he cannot be given any other medicine from the same class. A type 1 diabetic is the third person I can't use it with. Because a type 1 diabetic's body lacks insulin, our primary treatment is insulin. Oh, these treatments are in the form of injections, but there is no insulin in the end. Not all treatments administered via injection are insulin-based. A diabetic with gastroparesis is the fourth person who cannot use these treatments. The stomach muscle is partially paralyzed. We just said that these medications will reduce stomach movement, and because this person has partial paralysis in the stomach, he has very strong symptoms of nausea, reflux, and completely unpleasant digestive symptoms. The last person who is not permitted to use this group is someone who has previously experienced pancreatitis. The third and most important title is now with us. What is the difference between Saxenda and Victoza? Simply, the two are the same substance, but the dosage adjustment pointer, and the maximum dose of the medicine in each type, are different. In Victoza, the dose is 0.6 every day for 1 week, then 1.2 every day for 1 week, and finally 1.8 every day, as a maximum dose. But not in Saxenda is 0.6 mg, 1.2 mg, 1.8 mg, 2.4 mg, and finally 3 mg. Okay, sir, what is the distinction and what are these dosages? In reality, this initial dose of 0.6 mg has no effect on weight loss or diabetes. Why do I use it in such small doses? To acclimate the body to this medicine and try to minimize the medication's problems and side effects. In other words, allow the patient to become accustomed to the medication. So, there is no nausea or excessive regurgitation. Okay, for a diabetic patient, and he will use either type, the dose that he receives is determined by what on his tests. I mean, the doctor will start with any type of them and gradually increase the dose until we find the appropriate dose for him. Will you be able to maintain a normal blood sugar level? Of course, there are personal differences. And according to the blood test, we will choose the dose. However, the slimming dose is the dose that reduces or suppresses appetite, which is 3 mg of liraglutide. This means that Victoza will be ineffective for slimming. However, because of its high doses, Saxenda can be used for weight loss. The only distinction between Saxenda and Victoza is this. Come on over here for the main point. Assume the patient was using Saxenda to lose weight and the treatment was working well for him up to a dose of 2.4. A week later, we increased the dose to 3 mg, and he was supposed to finish it in order to get the strong slimming effect, but when it reached 3 mg, the treatment began to have very strong side effects, including nausea and regurgitation. What is the appropriate behavior in this situation? You instruct him to return to the last dose that worked for him, 2.4, and fill it with an injection every day for 2 or 3 weeks. After that, increase the dose to 3 mg, as this is the dose that will have an effect in terms of weight loss. What if he increased the dose to 3 mg and the same problems returned? What is the proper course of action here? Unfortunately, we will have to discontinue the treatment because it is not suitable for him as a slimming treatment. The fourth title, we will discuss is the most serious issues and potential side effects of using these medications, Victoza and Saxenda. The first issue is related to stomach and intestinal problems, which affect everyone who takes these medications. As we know, this substance, liraglutide, reduces stomach motility and reduces the transfer of food from the stomach to the intestines, so the food remains in the stomach, and this causes reflux and regurgitation in him. So, what is the answer to this problem? The only solution is to start the doses gradually, one by one, so the body gets used to it, and to add a dose every week. If the patient is unable to tolerate it, I can increase the dose every 2 weeks instead of every week. The second issue, which is more relevant to diabetics, is that this drug does not reduce blood sugar dramatically, which means it will not cause hypoglycemia. However, when combined with other diabetes medications that stimulate the pancreas to produce more insulin, these symptoms persist. That is why, when using these medications on a diabetic patient, we must regularly monitor the blood sugar level and the doctor must adjust the doses of these medications. The third issue is the occurrence of pancreatitis symptoms, which is a very important point that is sensitively related to us as pharmacists. Remember that many medications act on the pancreas, and thus symptoms of pancreatitis may occur with them, including this group. The patient will come to the pharmacy at any time and complain about the symptoms that I will describe now. And you discovered in his medicines any medicine from this group, so advise him to stop the medicine, and immediately must return to the hospital. Symptoms are severe stomach pain. Pains began to be heard in the back, near the stomach. The person perceives the stomach to be a rock and that there is something heavy in the stomach. He has come to inform you that I have the impression that something is pressing against my heart. He had nausea and severe reflux, which was worse than what he was experiencing at the start of the treatment. The person tells you that my heart is fluttering and that there is a significant increase in the number of heartbeats. Finally, he felt the temperature rise. These are dangerous pancreatitis symptoms. Discontinue treatment and return to the hospital immediately. The fourth title in today's episode is the proper way to use the medications Saxenda and Victoza. Keep in mind that it is like injecting insulin in the injection sites, so I can use it below the navel line and leave a distance of 2 or 3 centimeters away from the navel. I can use it on the thighs from the front, the arms from the back, and I always change the location of the injection so that there is no lipodystrophy under the skin, and we learned this method when we were discussing insulin injections. The fifth and final title, in today's episode. The most famous 14 questions the patient can ask you, and the wise pharmacist will know them. The first step for a patient with type 1 diabetes is that the doctor decides to combine insulin with a medication such as Saxenda or Victoza. What role will we play in this story? The correct behavior: you call the doctor before administering the treatment to warn him that there is a very high risk of a low blood sugar level, and your comment remains that we are supposed to reduce the insulin dose to nearly half before the patient begins using the Victoza or Saxenda treatment. The second question the patient always asks you is, how much weight will I lose while taking Saxenda? We keep in mind that the patient is supposed to lose at least 4% of his body weight in 4 months and more than 10% of his body weight in 6 months. If the patient used the treatment and got a lower percentage than that, his treatment is not right, it is not suitable for him, or he does not follow a healthy diet and exercise regimen while using the treatment. But the reality is that Saxenda produces very good results and the patient comes back with much higher numbers than that. However, these figures are the bare minimum of weight loss with Saxenda. The third and most important question is whether it is beneficial to use Saxenda to lose weight without dieting or a game? No, these are not true words. Any weight loss method in the world must be accompanied by a support system, as well as a diet. We must remember that the patient is only supposed to use the treatment for 5 to 6 months before discontinuing it, so if he didn't develop a good exercise routine, and a good diet, he will return to eating the same old foods, and his weight will rise once more. Exercise is important not only for losing weight, but it is also important because when a person loses weight, his shape stays consistent, because very often a person loses weight without exercise and diet, and he gets deformities in the shape of the body and sagging in the breast and sagging in the lower arms, sagging in the abdomen, sagging in the thighs, so exercise is important. Dieting and sports are very basic while using Saxenda, and anyone who claims otherwise is only interested in advertising. The fourth and most important point is, What are the most significant drug interactions while using Saxenda? Keep one very important point in mind: this medication reduces stomach movement. This means that if a person is taking medications, such as contraception, blood pressure medication, or oral diabetes medication, the transmission of this medication from the stomach to the intestines will be delayed. So take basic medications at least 2 to 4 hours before taking the Saxenda dose. The fifth question is whether it is safe to use these medications during pregnancy and breastfeeding. We should be careful during pregnancy because it is practically impossible for me to lose a woman's weight. A nutritionist should help a woman lose weight if she is overweight. She will diet and exercise, but weight loss drugs are not permitted during pregnancy. Furthermore, there have been no studies on this drug in pregnant women. The same is true for breastfeeding. Reducing food intake and losing weight through slimming treatments will have an adverse effect on the quantity and quality of milk. If a breastfeeding woman wishes to lose weight as well, and it should be done solely through diet and exercise. However, if the woman is pregnant or breastfeeding and is basically a diabetic, this is a different story, and treatment must be done through a doctor because the treatment system is different. The sixth question. Someone was losing weight with Saxenda, and it was working very well for him. For whatever reason, he discontinued treatment for more than 3 days. He wishes to use the treatment once more. Is it beneficial to use the same dose rather than a lower dose? Keep in mind that after more than 3 days of no treatment, we will begin with the first dose, 0.6, and then increase the dose every week. Start with 6 mg, 1.2 mg, 1.8 mg, 2.4 mg, and 3 mg. The seventh question is it appropriate to use this treatment on children? Keep in mind that children under the age of 12 are not permitted to use this treatment. Can I use it with a child who is overweight and a diabetic patient who is over the age of 12? No, because we stated that the weight loss dose is 3 mg, and the maximum dose in children does not exceed 1.8 mg in children. The eighth question. We've heard that this class of drugs protects the heart from strokes and heart problems. Is this true? The truth is that this is true, and now that metformin has been used, this group has risen to second place, and we always put it with all patients who have heart problems, because it truly protects diabetic patients from heart problems. The ninth question concerns the use of Saxenda in patients with liver or kidney disease. There are no issues, and the doses remain the same as the normal doses mentioned previously. The 10th question is, since you stated that the medicine is not insulin, should we keep it in the refrigerator or outside the refrigerator? These medications, Saxenda or Victoza, are stored in the refrigerator at temperatures ranging from 2 to 8 degrees Celsius. Keep in mind that it is illegal to freeze or keep these medications in the freezer. Keep the medication in the refrigerator and take one pen out to begin using it. You will leave it outside the refrigerator as soon as you begin using it until it is finished. And the medicine's effect lasts for 30 days at normal room temperature. The fourth point to remember when storing medicine is that if the temperature in your home is higher than 30 degrees Celsius, we can keep it in the refrigerator normally, as if we had not used it before, from 2 to 8 degrees Celsius. The 11th question concerns a patient who was involved in an accident or contracted a virus and went to the doctor, only to learn that he was a type 1 diabetic. Is it appropriate to use Victoza or Saxenda as a first-line treatment for type 1 diabetes? No, Saxenda and Victoza are used to treat type 2 diabetes, but if the doctor wants to use them for type 1 diabetes, he must combine them with insulin. He cannot use it alone to treat type 1 diabetes. The 12th question, which is frequently asked, is that a lady used the Saxenda and benefited from it, so she recommended it to a friend. Is it beneficial to use it on our own? No, this person who wants to use Saxenda must return to the doctor at the start and undergo the tests that we mentioned in order to determine whether or not Saxenda is appropriate for him. The 13th question, someone is coming to tell you that he used Ozempic injections for weight loss, and it actually caused him a very strong inflammation in the pancreas, and he was about to die as a result of it, and he was hospitalized as a result of it. He then heard that Saxenda injections are lighter than Ozempic and wants to give them a try. Is this correct or incorrect? Of course, this is incorrect. We just stated that the entire group can cause pancreatic problems or pancreatic inflammation, and if this problem occurs with a substance in this group, I cannot use the entire group. The 14th and final question is whether it is better to use Saxenda injections in the morning or at night. In fact, there is no difference between using it in the morning and using it at night, and the injection effect lasts a full 24 hours. But we prefer to use these injections at night before bed so that the person does not feel the side effects of it while sleeping. The important thing is the administration of these injections daily at the same time. I believe you have had enough of talking about Saxenda and Victoza today. This is the Octopus Pharmacist product episode for today. In the end, I hope I was able to provide you with new and useful information. If you enjoyed the video's content, please like, subscribe, and share. Don't forget to support the channel as well using Patreon, PayPal, and YouTube. Good health to you. Hussein Lotfi.